For some of those rural counties like Morgan County, the COVID-19 crisis is jump-starting changes to rural health care in mid-Missouri. ABC 17's Connor Hirsch joins us live at University Hospital after looking into the vulnerability of smaller counties in mid-Missouri. And Connor, access to health care in rural areas has been something health officials have been working on for years in the state.
Deb, many in rural communities have to travel to places like Columbia or Jefferson City to get their basic health care needs met. And the COVID-19 crisis is shining another light on the access issue to those Missourians.
I think we would definitely fall into a healthcare shortage. You know, there's issues with travel, being able to get to a clinic, being able to afford insurance, things of that nature. So, yeah, I definitely think that's an issue outside of COVID.
The state's website shows Morgan County as one of the top 16 most socially vulnerable counties. As like many rural areas, the population consists of a lot of low-income families and elderly.
You know, we're aware of those issues and try to keep those in mind as we're getting our messages out.
Morgan County is also one of 44 counties in the state without a hospital. While the county only has one reported case right now, the health department said roughly 70 people have been tested. There are only a couple of clinics that can test for COVID-19.
This next 2 weeks here is probably going to be a very telling time. I think there's just some issues that could show us if it's really a problem here in Morgan County or not.
The governor said today the state is working to address the immediate issue with over 90 mobile health care sites.
Every day we're taking a look at rural Missouri because it's one of the concerns we have. Every day we're taking a look at that, trying to figure out what services we can do better.
And MU Health has been working on rural health care for years. The CEO said today the crisis is forcing the system to learn and grow.
The benefit of this is we're not going to go back. We have now proven ourselves that we can provide this care at a distance.
And the CEO of MU Healthcare said that they usually do about 500 telehealth visits per year. But yesterday alone, the system conducted over 1,000 telehealth visits, showing that virtual health is growing. Reporting live in Columbia, Connor Hirsch, ABC 17 News.
Thank you, Connor. You can find a link to the state's data on our website at abc17news.com.